format when I published it. I didn't edit a whole lot, and I was very angry when I wrote it, and sort of a crazy person. I was on my second child dying from EB, and this entry that I'm going to read is dated February 22nd, 2008. My daughter Kaylee died March 1st, so I was going a little nuts at the time, so please bear in mind. When I was at the doctor's appointment with Kaylee a couple days ago, Dr. R gave me an article she had found entitled Treatment Decision Making for Patients with the Hurlitz Subtype of Junctional Epidermolysis Bullosa. Dr. Anna Bruckner published it in the Journal of Perinatology in 2007. Too bad it wasn't published sooner. It would have been nice to have in 2004 when Ethan was born and the asshole doctors wouldn't let me take him home from the hospital, and then again in 2005 when Ethan was dying and the asshole doctors wouldn't let me take him home from the hospital. Again, no offense intended to the doctors in the room or anyone else. Anyway, here's the facts and stats about JBH according to this paper. It is a lethal disease. There is no cure. Mortality in the first year of life approaches 90%. It is the rarest type of EB. Patients likely live lives filled with pain and distress. Medical interventions can at best delay death. It is impossible to prevent new blisters from forming. And most deaths are caused by sepsis. These are verbatim quotes from the text. The article then goes on to talk about the role of the physician in the treatment of JBH as a fatal disease and the responsibility to take into account the Hippocratic Oath when doing so. Quote, imposing treatment on the dying patient is not a benefit, but an abuse, it says. And then quotes Hippocrates as saying that the definition of practicing responsible medicine should be, quote, to do away with the sufferings of the sick, to lessen the violence of their disease, and to refuse to treat those who are overmastered by their diseases, realizing that in such cases medicine is powerless. Now that guy I could get along with. The medical profession, especially the pediatric medical profession, has seemed to forget what their ultimate role as practitioners is, to prevent and relieve suffering and not do further harm. Now, if this means letting a patient die, then they should be able to accept that. Who the hell gets into medicine thinking that all of their patients are always going to live? These jerks that were treating Ethan treated me like garbage when I wanted to call it quits. I was the only one in that hospital that was thinking about his best interest. The article even says that once a diagnosis of JBH is made, all efforts should be made to convince the parents of the child to withhold and or withdraw medical treatment, even if an ethics committee eventually needs to be consulted to do so. Now, here's what happened at Children's Hospital in Pittsburgh. Against my better judgment, when Ethan became extraordinarily anemic, his pediatrician and my family convinced me to hospitalize him for a blood transfusion. He was about 6 months old at the time. I cannot fault my family for this because I had not kept them up to date with Ethan's rapidly downhill progress. And they were shocked to learn how sick he was. Also, all of his doctors seemed to think that he would be fine, so that's what my family thought. Ethan, at this point, was not responsive to me or anyone else and only woke to eat or cry. I felt like my Ethan wasn't even in there anymore, like he had already vacated his body. But I agreed to a transfusion in the event that it might bring him back, as his pediatrician said, even if it was only temporarily. So he got one, but not after first having to endure at least 3 incompetent nurses trying to put an IV catheter into him. And he did not come back. And his body was so compromised at this point that the blood that they were giving him wasn't even staying in his veins. It was backing up and overloading his lungs. But the doctors didn't know this because they are idiots, so they sent him home. And he was no better, and in fact was much worse. So I brought him back to the hospital where they gave him another transfusion because his tests were showing that he was still anemic. But first we waited in the waiting room at the hospital for almost 2 hours with my dying, barely conscious baby. And his pediatrician had phoned them in advance to let them know we were coming. There was no real triage system. When someone walks into the emergency room, presumably with an emergency, a moron behind the front desk tells you to write your child's problem down on a piece of paper. I didn't know what to write and figured no one would know what epidermolysis bullosa meant, so I wrote pneumonia. Because at this point it was obvious to me that he had fluid in his lungs. It was coming out of his nose when we held him upright. There was a triage nurse that would come out every once in a while, holding some person's paper up to his face, not even looking at the children in the waiting room, and call that person back to the triage area. They were deciding who was most sick by looking at a piece of paper, not by looking at the patients. Finally, Ethan had diarrhea everywhere, and I had had enough. I grabbed the triage nurse and said, "Look, my son is barely conscious. Can we have a room now, please?" He immediately took us in, took some blood, and commented on how cool it was to see an EB patient because he had just been reading about EB but had never had a patient before, and then tried in vain to get an IV catheter into Ethan. Yeah, cool. Ethan's blood work had only one normal value, a kidney value, and the rest was showing that he was shutting down. All of a sudden, we had lots of people that wanted to treat Ethan, when we had had none just a few minutes before. So we were whisked around to a few places and ended up in radiology, I think, with several doctors discussing, as if my mother, sister, and I weren't standing there, what to do with Ethan. Finally, one of them said, "Page surgery. We'll have to put a central line into him." And finally, I spoke up. I said, "No, we're not doing that. You're not going to create a hole in him that will never heal and try to stick a large gauge catheter into his neck to rehydrate him and give him blood and antibiotics that won't work anyway. No." And everyone stopped. I think I could have been able to hear the earth turning on its axis. And in slow motion, everyone turned to look at me. Finally, in the confused silence, one of the doctors stammered, "Are you putting limits on his care?" The words would echo in my head years later. "Yes," I said. "Yes, I am." There started the war between the doctors and me. I was the bitch who wouldn't let the students in, wouldn't let them take pictures of him, wouldn't let them stare and gawk and ogle over him as if he were a science experiment. Two doctors who wanted to stay and watch his bandage change had the nerve to tell me that I should have been wearing gloves. I wanted to scream, "This kid never had a skin infection in his life until you people got a hold of him." But yeah, whatever, you must be right because you're the doctor and I'm just the idiot mother who does the bandage changes with no gloves. In any case, they ended up giving him a second transfusion, and while doing so, I watched the nurse drop the line, which was obviously supposed to stay sterile, and then hook it up to him anyway. So he became septic, and then somehow he contracted salmonella. And then they diagnosed C. diff bacteria in his gut too, and he kept living. And finally, I had had enough. I don't know why I didn't say it earlier. I think it was because I was so worn out. I had been sleeping on a hospital chair for days, and while I was awake, I was guarding Ethan from the nurses who wanted to, for instance, destroy the skin on his feet by hooking up a pulse oximeter. Other nurses, when I would complain that Ethan was in pain and needed his pain medication because it was due, would tell me that those orders just meant that they had to give it to him within that hour, not exactly on the hour, to my son, who was in constant, horrible agony due to excruciating pain. Anyway, so I was there all the time. Parents aren't usually allowed to stay, but they let me because I was the only one who knew how to take care of Ethan. I would walk through that ICU in the middle of the night, and there were children lined up in beds opposite the nurse's station with only curtains separating them, and they would all be awake, staring at me vacantly. None of them ever spoke. It was like looking in a mirror. We all had death and sickness in our eyes. It was like being in hell. They were all hooked up to IV and oxygen and God knows whatever else, and they all must have been so scared, but there were no parents anywhere. So finally, I said enough, and then the doctors said no. They sent 4 or 5 people in to talk to me, which took several hours, and each one would try to convince me not to take him out of the hospital. And to each one of them, I would shriek, "You can't fix him. You might, out of some miracle, be able to reverse all of the damage you did to his lungs and his gut, but you can't fix his skin. After all that, he will still be missing